A semen analysis or a sperm analysis or a spermogram is often used to find out the cause of male infertility. In order for the semen analysis to be accurate, it is necessary that the man has a period of abstinence of 3 to 5 days before providing the sperm sample. The World Health Authority establishes the minimum values for a sperm sample to be considered normal. And from the results of the sperm analysis, if there are any alterations, we can then classify what exactly is the problem in the sperm. The first step in a semen analysis is to perform the macroscopic study. This means a study performed with the naked eye and not with a microscope. One of the first things they will look at is the appearance of the sperm sample. The semen should have a yellowish grey colour. Any alterations in the colour of the sperm may indicate an infection. The volume of the ejaculate is also studied. It's generally between 2 and 4 millilitres. However, this can depend on the level of abstinence performed and the day in question. Liquefaction of the sperm sample is something that should occur approximately 20 minutes after the sperm sample has been allowed to rest. The viscosity of the sample will also be studied if there's threads present in the sample, and the pH, which is a measure of the acidity or alkalinity, will also be studied. These are obviously things that the patient themselves may be aware of in their own semen sample. Then there is also the microscopic study. Using microscopes in the laboratory, the following things are also looked at. The motility of the sperm is studied. So all of the sperm need to be able to move forward progressively in order to be able to reach the egg for fertilization. It's important to look at how the sperms move. A sperm count is done. The concentration of the sperm present in the sample is also looked at in a special counting procedure. They will also look at the morphology of the sperm to make sure the head, the midsection and the tail are properly formed. Sperm vitality is also looked at. Sometimes there are dead sperm present in the sperm sample, which will obviously not be able to fertilize an egg. There are any leukocytes visible under the microscope. These are white blood cells. It may be indicative that there is an infection present. The results of the macroscopic and microscopic study are put together to give you the report of your semen analysis.